I don't know about being a hero, but the rest of it holds true. I'm a little nervous, so please bear with me. I've got a lot of things to say, a lot of details that can support it, but I only have a few minutes, so I'll try to make it as fast as possible. So fasten your seatbelts and hang on for the ride. Like I said, like Jeff said, about 2 years ago, 2.5 years ago, I started experiencing some symptoms that didn't quite seem right. So I went to my doctor, went through the symptoms. 3.5 weeks later, this would be the first part of December, I was sitting in a chair getting chemotherapy. I had a colonoscopy, I saw a GI specialist, I had blood tests, I had PET scans, I had a CAT scan, I saw an oncologist, I saw a surgeon, I had a port installed in my chest, which is still there, I still get chemo, all in 3.5 weeks. Plus I was gone for 1 week because early on I didn't think it was very serious, so I went ahead and took a business trip. So 3 weeks from the time I went to the doctor, I was receiving chemotherapy, and it was very aggressive. If anybody has ever had chemotherapy, you know what it's like. There you go. You know what it's like. It's everything they say about it is true. Even the doctors, politicians certainly, don't know what chemotherapy is like until they've had it. It wears you down. There's a lot of side effects that are hard to explain unless you've been through it. So that went on for 6 months. For another year, it took me into early 2008. My oncologist, who by the way was very aggressive, did the right thing, gave me options. She didn't tell me exactly what was going to happen. She said, here's some options, this is what we should do. I made the decision to do those. So about a year after that, early 2008, she said, it's time to remove the tumors. We have to resect. I have colorectal cancer with liver metastases. She said it's time to remove the tumors. We have to get those out. So I consulted a surgeon here in Denver who looked at my case, and I had more scans done, more tests done. And we sit down for about 2 hours, my wife and I and the doctor, the surgeon. He said, because of the position of your tumor in your liver, this is very risky and very dangerous. I think we can do it, but I'm not sure until we start the operation. I can do some exploratory procedures on your liver. Then I'll know if I can do it for certain. So when I went into surgery, it was anesthetized, and I woke up, 6 hours later. I didn't know if it was successful or not. So I was a little scared. Fortunately, my two brothers were there, and I knew they were alive, so I figured if I'm seeing them standing there, I must be alive as well. So that was a good thing. And then the surgeon came in and said, we were able to remove the tumor, but I had to take your entire left lobe of your liver and half of your right lobe. So I had 2/3 of my liver removed. That's impressive, I think. That's very impressive. And during the operation, the surgeon tested a couple of new devices that were on the market. They're trying to see how they work, to see if they're useful, and to provide feedback back to the appropriate companies to use those in the future to help other people that are in my situation. So the surgery was last May of 2008. And since then I've had, my results have been good. I've had plenty of scans. I'm still on chemotherapy. It's still present in my body. It's still being fought. So what I did discover a few months ago, and I'd like to make a point that my oncologist was born and raised in a socialist country. She has been there. She was trained as a doctor in a socialist environment. She practiced in a socialist environment. She taught in a socialist environment. And the first chance she had, she left the social environment and decided to practice here. So thanks to her, I'm able to stand for you today and talk. The point that's very critical here that I'd like to make is I discovered a few months ago that the procedure I had, because it was leading edge and very risky, there's not a lot of it done, so no one knows the full impact of what happens, is that if I had been on Medicare at the time of my surgery, I would not have been allowed to have the operation. It would have put me back to chemotherapy and tried other therapies to prolong my life. The surgery I had last May, by all accounts, all statistics I've read, the doctors, surgeons I've talked to, suggest that if I had not had the surgery last May, I would not be allowed to be standing here alive today talking to you about it. So this is very important to me. Thank you.
Thank you, Dale. You waged war for our country, and you're waging one right now. Thank you for your help. I want to absolutely. I want to introduce to share the perspective of the business community with you. I'd like to welcome Preston Gibson, President and CEO of the Jefferson Economic Council. Preston.
Good morning, and thank you for allowing us to speak today. I am here today in support of the Campaign for Responsible Health Reform and to represent our membership throughout Jefferson County. The Campaign for Responsible Health Reform is a coalition of businesses, individuals, and community-based organizations that believe that healthcare reform is necessary and it's urgent, but not at the expense of what works today, which is our private healthcare system. Employer-sponsored health insurance has been the foundation of the highest quality health care on earth. A public option will likely eliminate that foundation. Implementation of a public option is the first step towards a single-payer health care system, which is available, of course, in Canada and Europe, where fewer procedures are covered, where wait times for consultations and surgeries are significantly longer, and where government bureaucracy is rampant. Is that what we want? It's not what we want in this country or in this state. A government-run plan is fiscally reckless. The plan would mean new taxes and a backdoor premium that will make healthcare costs higher, not lower. If you believe it's lower, I don't know what's wrong. It is certainly not going to cost us less. Moreover, businesses and taxpayers will be stuck paying for a government-run plan through higher taxes. We can't afford these costly new taxes at a time when our economy is facing very real challenges. Healthcare reform is necessary, but not at the cost of what works. Thank you.
Thank you, Preston. And it's great to have the business community engaged on this issue. We're going to win this because of this kind of movement, grassroots movement across America, and we need everybody pushing towards that. Absolutely.